When California rolled out its new $300 a month Social Security supplement for 2025, the message was clear. The federal government's 2.5% COLA hike isn't enough. It's not just a raise. It's a survival adjustment. For low-income seniors and disabled residents, that extra money could be the difference between choosing groceries or medication. And California isn't alone. States like New York, Pennsylvania, and Massachusetts are following suit with their own targeted boosts. Each state is building a lifeline where federal policy falls short, and that patchwork is quickly becoming the real support system for SSA, SSI, and SSDI recipients. This video breaks down the 10 states delivering the biggest Social Security raises in 2025.
Backhand index pointing right. If this information helped you, don't stop here. Hit that subscribe button and turn on notifications so you're always one step ahead. We break down important updates like this clearly so you're never caught off guard. Join our community, stay informed, and take control of your financial future, starting today. Flexed Biceps Calendar.
From Vermont to Michigan, and what it means for people living on fixed incomes. With monthly increases ranging from $200 to $400, these localized supplements are doing what federal COLA can't, keeping up with inflation. We'll look at how each state is structuring its program, who qualifies, and why this may signal a broader shift in how we approach Social Security support. 2025 is bringing some serious changes to Social Security, especially if you live in one of 10 key states. If you're receiving SSA, SSI, or SSDI benefits and you live in California, New York, New Jersey, Pennsylvania, Vermont, Massachusetts, Rhode Island, Connecticut, Delaware, or Michigan, listen closely. You are in the best position to benefit from one of the most meaningful boosts to Social Security in over a decade. Not from Washington but from your own state. While the federal government announced a modest 2.5% cost of living adjustment, it barely scratches the surface of what recipients actually need. Inflation may not be rising as fast as it was in 2022 or 2023, but the damage is done. Rent is still high. Groceries are still expensive. Prescription costs haven't gone anywhere. That 2.5% increase might cover a couple of extra grocery trips, if you're lucky, but it's not enough to restore financial stability for seniors and disabled Americans who've been falling behind for years. That's where these state-level programs come in. 10 states are rolling out supplemental payments designed to actually reflect what it costs to live today, not 5 years ago. We're talking about additional monthly benefits of $200 to $400 depending on where you live and your individual situation. This isn't a theory. It's not a proposal. It's happening right now. States like California are leading the charge with flat-rate supplements that offer all eligible recipients an extra fixed monthly amount. California already has one of the highest costs of living in the country, so this added help is critical. In New York, they're adjusting the supplement based on the cost of living in your county, because the rent in Manhattan is not the same as it is in Buffalo. They're targeting the assistance to meet the reality on the ground. In Pennsylvania, the state is focusing its help on seniors over the age of 75, a group that's often been overlooked in budget discussions. That's a demographic that's facing increasing health costs, limited mobility, and often no other source of income. The goal: make sure they don't have to choose between medication and heating their homes this winter. This isn't just about generosity, it's about necessity. The federal COLA system is broken. It's calculated using the Consumer Price Index for urban wage earners and clerical workers, or CPIW. The problem is that CPIW doesn't reflect the spending habits of seniors or people with disabilities. It underestimates how much they spend on healthcare, on housing, and on essentials. That's why more and more policy experts are pushing for the government to adopt the CPIE, the Consumer Price Index for the elderly, which better matches how retired and disabled Americans actually spend their money. But until that happens, and let's be real, that kind of reform takes years, even decades, these state programs are the front line of defense. They are bridging the gap between what the federal government provides and what people actually need to live with dignity. Critics, of course, are already raising red flags. They say these state programs aren't sustainable. They point to the cost, the administrative complexity, and the risk of future budget shortfalls. And yes, those are real concerns. But let's be clear. The bigger concern is what happens if we don't act. If we don't provide this help, millions of people will continue to fall through the cracks, trapped in a cycle of rising costs and stagnant benefits. States are stepping up because Washington isn't. They're creating patchwork solutions because the national safety net is no longer catching everyone. Is that ideal?
No.
Is it necessary? Absolutely. Let's talk numbers. For someone receiving the maximum SSI benefit, say around $943 per month in 2025, a $300 state supplement could represent a more than 30% increase in monthly income. That's not a small change. That's the difference between buying fresh food or skipping meals, between seeing a specialist or waiting in pain, between heating your home in February or layering up in blankets. This money matters. And it's not just about individuals. This support flows through entire communities. When low-income seniors and disabled residents have more to spend, that money gets used. It goes to the local grocery store, the pharmacy, the landlord, the electric bill. It's economic stimulus that stays close to home and keeps vulnerable populations stable. What's important to understand is that each of these state programs is different. California's approach won't look the same as Michigan's. Some states use a flat rate model, others use income brackets or cost of living adjustments. Some tie it to age. Others factor in disability severity or local rent benchmarks. That means eligibility and amounts will vary. And it's absolutely essential for recipients to confirm details directly with their state Social Security offices or benefit coordinators. Do not assume you qualify. Check your status and get the facts. These programs are a response to an economic reality that no one can deny. Yes, inflation is down from the peak, but that's not the same as prices going down. Rent doesn't deflate. Healthcare costs don't just reverse. Seniors and disabled individuals are still living in an economy shaped by years of skyrocketing prices, and the federal response hasn't kept up. That's why the push for federal reform is gaining steam. There's momentum behind proposals to not only switch to CPIE but also increase the base SSI and SSDI benefit amounts across the board. Advocates argue this is long overdue, pointing out that the current system assumes people can live on income levels set decades ago. Spoiler alert, they can't. The question now is whether Congress will act or if more states will be forced to step in and create their own stopgaps. Either way, the system is changing, slowly but surely. And those changes start with people knowing what's available to them and speaking up when something isn't working. To the millions of SSA, SSI, and SSDI recipients, this is your moment to act. If you live in one of the 10 highlighted states, look into these supplemental programs immediately. Even if you've applied before, check again. Eligibility rules can change. Payment tiers can shift. You do not want to leave hundreds of dollars per month on the table because you didn't confirm the latest info. If you live outside those 10 states, don't tune out. Talk to your local representatives. Ask what your state is doing. Pressure your elected officials to recognize that a one-size-fits-all federal increase doesn't work in a country where the cost of living swings wildly between regions. This isn't charity. It's policy catching up to reality. Seniors and people with disabilities have earned these benefits, through work, through sacrifice, through contributions to a system that promised to be there when they needed it. Now it's time for that promise to be fulfilled, not just with words, but with action and funding that matches the real world. Stay alert. Be proactive. And always double-check information directly with your state's official resources, Social Security office, or benefit administrator. If this issue affects you or someone you love, speak up in the comments. Share your story. Let others know how you're navigating the system, and what kind of support would actually help. And most importantly, make sure your voice is part of this conversation. The system is changing. Let's make sure it changes in the right direction. For too long, federal Social Security recipients have been forced to make do with adjustments that look good on paper but don't hold up at the checkout counter. When the Social Security Administration announced the 2.5% COLA for 2025, headlines were quick to call it a win. But a 2.5% bump on a benefit that was already stretched razor-thin, that's not a win. That's the government handing you a leaky umbrella in the middle of a storm and saying, "Good luck out there." And for many recipients, the storm hasn't let up. Just changed forms. After the pandemic, after supply chain chaos, after housing shortages and rising healthcare premiums, that 2.5% gets swallowed instantly. Which is why the 10 states offering supplements in 2025 are not just reacting, they're taking responsibility for the gap left by federal inaction. In these 10 states, legislators have acknowledged something painfully obvious. Inflation doesn't treat everyone the same. If you're living on a fixed income, inflation doesn't just sting, it crushes. It turns every bill into a balancing act. Turns every grocery trip into a math equation. And it turns retirement into stress, not security. California, for example, has rolled out a flat monthly boost. It's simple, direct, and gives people what they need without forcing them through miles of red tape. New York's system is more complex, adjusting the supplement by county. A person in Queens may get more than someone in rural upstate New York, but that's the point. They're tailoring the help to the cost of living in each specific community. Rhode Island and Connecticut are following suit with income-tiered models, making sure the lowest-income recipients get the highest boosts. Massachusetts and Vermont have added automatic enrollment to their programs, so seniors don't miss out simply because they didn't know about it. That's key. Awareness. Because the reality is, even with these programs in place, too many eligible people still aren't getting the help they deserve, because they don't know it exists. It's why this conversation matters. Let's take a closer look at the real-world impact. A $300 boost every month. Over the course of a year, that's $3,600. That could mean finally affording dental care that Medicare doesn't cover. It could mean catching up on utility bills, replacing an aging refrigerator, or buying hearing aids without going into debt. These aren't luxuries. They're basic needs that have been priced out of reach for people who've spent their lives working and paying into the system. The disconnect between federal policy and day-to-day living is staggering. Washington is acting like a 2.5% COLA is generous. Meanwhile, the average rent increase in some cities last year was closer to 10%. Grocery costs jumped over 20% in the past 2 years. Health insurance premiums skyrocketing. And yet, Social Security increases are still calculated using an index that doesn't even factor in seniors' true spending habits. That's why there's a push to switch from CPIW to CPIE. The current system is outdated. It's based on wage earners and clerical workers, not retirees. It underestimates just how much more seniors spend on essentials like healthcare, prescription drugs, and housing. The CPIE would shift the formula toward the reality seniors face today. But until that change is made federally, states are taking matters into their own hands, and they deserve credit for doing so. At the same time, it raises an uncomfortable truth. Access to meaningful support now depends on where you live. If you're in one of the 10 participating states, you're in luck. But if you're in Florida, Texas, or dozens of other states, you're left behind. That patchwork approach isn't sustainable long-term. It's better than nothing, but it's not equity. The big question then is, how do we fix it? One answer is sustained pressure. From voters, from advocacy groups, from seniors and people with disabilities demanding that the federal government modernize its benefit system and finally acknowledge the real costs of aging and disability. Because these state programs are sending a loud message. If Washington won't lead, states will. But even that leadership has limits. Skeptics are already pointing to budget concerns. Where will the money come from to sustain these programs year after year? Will other services get cut? Will taxes go up? These are fair questions, and states will need to answer them transparently. But what's not acceptable is using fiscal responsibility as an excuse to underfund seniors and disabled residents who've already paid their dues. These programs are investments in people, in health, in dignity, in stability, and yes, in local economies. Because when vulnerable populations are stable, everyone benefits. Local businesses, public health systems, even housing markets see positive ripple effects. What's crucial now is that recipients act. Benefits aren't automatic in every state. Some require updated documentation. Some require reapplication every year. Others may only send supplements to people who have applied for certain types of aid. You need to confirm your eligibility with your state's Social Security office or the agency handling the supplements. Don't assume anything. Don't wait. Get the facts. And if you're in a state that isn't offering these boosts, start organizing. Contact your local legislators. Ask what's being done to support your community. Because these 10 states have set a precedent. They've shown that it can be done, and that it makes a real difference. It's time others followed suit. This moment is also about reshaping the national conversation. Social Security isn't a handout. It's not charity. It's a contract. A promise made to American workers that if you paid in, the system would be there for you. And right now that promise is wobbling. Not collapsing but definitely cracking. The 2025 COLA increase. It's a band-aid. These state-level supplements. They're more like temporary bridges. But what we need is full structural reform. Reform that recognizes people can't live on $943 a month when the average rent for a one-bedroom apartment in many places is over $1,200. Reform that reflects 21st century economic realities, not 1970s cost tables. If you're someone watching this and thinking, well, I don't need this now, but I might later, this is your fight too. Because Social Security affects everyone eventually. Whether you're years from retirement caring for an elderly parent or living with a disability, what's happening in these 10 states is a preview of what could happen nationwide, if people push for it. Don't wait for Congress to act out of kindness. They act when people speak up. Loudly. Relentlessly. With facts and stories and pressure. So share this video. Talk to others who rely on SSA, SSI, or SSDI. Help them get informed. Help them apply. Help them navigate this system. Because it wasn't built to be easy. To everyone in California, New York, New Jersey, Pennsylvania, Vermont, Massachusetts, Rhode Island, Connecticut, Delaware, and Michigan. This is your moment. You are finally getting a meaningful boost. Don't let it slip through the cracks. Check your mail. Review your eligibility. Talk to someone at your local benefits office. Get what you're owed. Let's get one thing straight. This didn't happen because politicians suddenly woke up and grew a conscience. These state-level Social Security boosts didn't appear out of thin air. They happened because people demanded action. Seniors, advocates, disability rights groups, and struggling families made enough noise that state lawmakers couldn't look away anymore. This is what happens when the pressure gets real. It's not perfect and it's far from complete. But it's a start. In the absence of strong federal leadership, the states had to step in. And while 10 states are leading the charge, 40 others are still on the sidelines, watching, hesitating, waiting for someone else to go first. But the truth is, there's no more time for hesitation. Because the crisis is already here. Go ask anyone living on SSI or SSDI if they think that 2.5% COLA is enough to cover their cost of living increase over the past year. They'll laugh if they don't cry first. You think a $25 or $30 monthly bump makes up for rising rent, spiking medication costs, or the fact that groceries have basically doubled since 2020? Well, doesn't even touch it. That's why the states that acted deserve credit. They saw the federal inaction and said, we're not going to sit here and watch our most vulnerable neighbors slip into poverty. They saw the math wasn't adding up and decided to do something about it. Whether it was a flat payment or a tiered adjustment or age-based targeting, these programs have one thing in common. They're rooted in reality. Because the reality is brutal. Seniors are skipping meals to afford prescriptions. People with disabilities are choosing between transportation and rent. Veterans are stretching every last penny because the government programs they were promised have been chipped away by decades of budget cuts and political games. And let's talk about those games. There's a faction of politicians who love to stand in front of a microphone and talk about protecting Social Security, but when the time comes to actually fund it properly or modernize the system, they vanish. They pretend the crisis doesn't exist. They blame the recipients. They use scare tactics about ballooning budgets, while passing tax breaks for billionaires. That's not governance. That's neglect. Meanwhile, states like New Jersey and Michigan are proving that you can provide targeted financial relief without breaking the bank. Delaware and Vermont are tailoring their programs to meet regional needs. This isn't pie-in-the-sky idealism. It's practical policy rooted in economic reality. And yes, we should be asking the tough questions about sustainability. Where is the funding coming from? How long will these supplements last? What happens if state revenues dip? But here's the bigger question. What's the cost of doing nothing? What's the price of letting inflation continue to hollow out fixed incomes? What happens when seniors can't afford housing? When disabled residents are pushed further to the margins? When basic survival becomes a daily battle? These are the consequences of inaction. And they're already happening. Which is why these state supplements are not just helpful. They're essential. It's also why every eligible person needs to act now. Do not assume you're automatically enrolled. Do not assume that last year's rules still apply this year. Some states require re-enrollment. Some may have updated eligibility criteria based on income, age, or household size. You must contact your state's social services office or social security agency and verify your information. These supplements are too important to miss. If you qualify for an extra $300 a month and don't claim it, that's $3,600 a year you're walking away from. That's life-changing money for someone on a fixed income. That could mean finally seeing a dentist, finally catching up on utility bills, finally having breathing room. But you have to take the first step. You have to ask. You have to check. And if your state isn't on this list, California, New York, New Jersey, Pennsylvania, Vermont, Massachusetts, Rhode Island, Connecticut, Delaware, Michigan, then you have every reason to start asking why. Why isn't your governor taking this seriously? Why isn't your legislature doing more to support fixed-income households? Why is your state content to sit on its hands while others are delivering real, tangible help? Because this shouldn't be a matter of geography. It shouldn't depend on your zip code. But right now it does. And that's not fair. That's not sustainable. And that's not the America Social Security was supposed to represent. This program was built on a simple promise. After a lifetime of work, or in the face of severe disability, you wouldn't be left behind. That promise has frayed. These state programs are trying to patch it back together. But the real fix, that has to come from the top. Until then, know this. You have more power than you think. Your voice matters. Your vote matters. And your experience matters. Whether you're a senior living in a rent-controlled apartment in Boston, a disabled veteran in Detroit, or a homebound SSI recipient in rural Pennsylvania, your story is part of this national reckoning. So stay informed. Say loud. Stay involved. Share this message with others who need it. Help someone apply. Ask your state representative what they're doing about Social Security. Be relentless. Because this isn't just about money, it's about dignity. And for now, if you live in one of the 10 states stepping up in 2025, use it. Take advantage of these supplements. Secure what you've earned. And remember to always confirm the latest details directly with your local Social Security office or your state's benefits department. This is your money. This is your support. Claim it. Demand it. Don't let anyone tell you that you're asking for too much. You're asking for what was promised. And now, finally, some states are starting to deliver.